Being hospitalized is typically a scary experience, one that could become more dire as the need for nurses grows.
The nursing shortage right now has been kind of called a national emergency, and we are feeling it here in the state of Georgia.
Associate Director of Undergraduate Nursing Programs and Kennesaw State University Professor Rachel Myers knows how important it is to educate and train the next generation of nurses.
The demand for nurses is higher than ever, almost, at least in my lifetime, and probably one of the greatest needs in history. And this is due to a lot of different reasons, I think. The number of nurses retiring is at a faster pace than we can get new people starting in. So there's just that sheer demand and supply issue. But also with the COVID pandemic, of course, that impacted the numbers with some people not starting or deciding not to go into nursing, and that's another critical reason why we need to educate these nurses and getting them out into the healthcare area.
To improve the issue of supply and demand for nurses, Kennesaw State University is focused on increasing faculty and staff so we can get more nurses into the pipeline. In 2020, the university set a goal to double enrollment by 2025 and received a multi-million-dollar grant from the Wellstar healthcare system to support those new students, faculty, and staff members.
Also, we are able to use that funding for resources. It has enabled us to buy more equipment, that high-tech equipment, some simulation equipment.
KSU also offers an accelerated degree program for students like Emily Tate, who hold a bachelor's degree in a different field to incentivize those looking for a career change to consider nursing.
I have a previous degree in biochemistry. I had been planning to go to medical school with that, and my husband was in the military and deploying and stuff, so it just wasn't the time for medical school. And then I was a stay-at-home mom for a couple years.
Her family moved around the country and ended up in Georgia when she had a chance encounter with a KSU nursing student.
It was actually when I was at the hospital delivering my daughter at Kennesaw that I had a KSU nursing student helping to take care of me. And she told me about the accelerated program because she was in the accelerated program. So that was kind of when I was like, all right, I'm going to go to KSU.
Concepts learned in the classroom are put to the test in hands-on simulation labs.
Our curriculum in the Wellstar School of Nursing is comprehensive. It's holistic. It is based on the most current evidence and the dynamic changing needs of our healthcare today.
By the time they graduate, students have also spent hundreds of hours working in local hospitals.
Between all of that in-class activity as well as the application, it really promotes a robust experience for them to help them pass the licensing exam when they graduate, but more importantly, to have that smoother transition from when they graduate, going from academia to the bedside.
After shadowing nurses at Children's Healthcare of Atlanta, Junior John Baccaron discovered his interest in pediatric care.
I realized, this is what I really like. I love going to work. It's something new every single day, especially working in the emergency department.
Outreach to younger students is also an important piece in fighting this national emergency. Baccaron holds a leadership position in KSU's award-winning Student Nurses Association focused on outreach and visits local high schools to explain what a nursing career entails.
Back when I was in high school, I really wished that I had someone actually to tell me what nursing is like. That's what I'm really passionate about.
Myers says KSU's holistic approach, preparation using hands-on experiences, and focus on stress management will hopefully fight nursing burnout and prepare students for a rewarding nursing career.
The students that we have are just simply amazing. It just blows me away how this next generation of nursing students, they are so enthusiastic. They are go-getters. They have such dedication to wanting to be a nurse because they really want to help others.
Baccaron is preparing for his final 2 semesters as a nursing student, and Tate just accepted a job as a labor and delivery nurse.
It's been a really supportive environment here. I've really enjoyed the professors that we have here. Most of them are really caring and adaptable and flexible. So it's a good experience, and I think it prepares you well for the real world of nursing.
As for the goal of doubling enrollment by 2025, we are on track to do so. More than 700 nursing students were enrolled this semester, up from about 500 in 2020. You can read more about KSU's various nursing degree programs by visiting the website below.